Hey there, Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Yeah, I know. I still hate the title, but we can't change these things once we start. Well, anyhow, we're coming off Easter week, so we actually have it's a Friday morning. I'm a little slower than normal, which is fine. The kids are on vacation this week, so I'm in a ghost town for the most part. But today, what I want to talk to you about is knee pain decompression therapy. So let me ask you a question. Do you have chronic knee pain? Have you tried countless treatments with no success? If so, knee pain decompression therapy with the knee on track may be the answer to your prayers. This therapy is very few people have because everybody thinks they're going for knee replacement, knee surgery, or just physical therapy. And this therapy, the knee on track, is proven to reduce and even eliminate knee pain in a matter of weeks. And I know it sounds like a very bold claim. And what happens is it basically helps your knee produce more synovial fluid. So it kind of tractions, it gentle tractions out the knee joint. And within the knee, you have the meniscus is like a disc in the spinal bone, or meniscus is that for your knee. And a lot of times, if you don't have enough synovial fluid, that gets inflamed. It kind of cracks a little bit, and you can have pain. It flaps, and then you may need to have surgery. But if you want to avoid surgery, just think about putting a sponge. You've been away for a few days. A sponge on the side of your sink is all dried out. You put a little bit of water in it, pops right up. That's kind of the whole simple um, way that the neon track for decompression therapy works. Now, I'd have to say I'd be remiss if I told you it's the only thing is because there's a lot of other stuff to do for a knee pain. A lot of other stuff. We use a special method called trigenics where we work the different knee muscles. Okay, so it's really not it's not an exercise. Put it this way, when I'm done with you, you come in here for knee pain, I'm sending you out to physical therapy afterwards, unless you're a good person, good enough to listen and do it on your own. Because a lot of the knee therapy, physical therapy, you can do on your own, but you have to be diligent. Once the pain's gone, doesn't mean you're better. Now you got to get out there and work the knee and use it and start strengthening the tissues up. But it's harder to strengthen the knee if you have changes or alterations in the nerves that supply the knee and actually supply the brain. Afferent uh, flow goes to your brain. Your brain's got to understand what's going on with that knee, and when it doesn't, chances are you're gonna have pain. And we have a couple different nerves that we work, and one nerve is particular is called a Golgi tendon organ, a GTO, and the Golgi tendon organ is a muscle tendon. And what happens is, from a standpoint, without getting too complicated, that helps inhibit pain when everything is copacetic. Everything is there's a good flow from the knee to the nerve and the spinal, the lateral horny spinal column, and it sends a signal right up to your brain. When it's flowing, it helps inhibit pain. When that is broken or not communicating properly with that part of the spinal cord itself, you'll develop pain. So the way to reintegrate that is a technique called trigenics, which is absolutely wonderful. But you have to check out a whole bunch of muscles. So you have to check out the rectus femoris, vastus medialis, vastus lateralis, the popliteus, which is behind the knee, often over often overlooked in many cases. That's the muscle behind the knee that helps lock the knee into extension. So you get these things working properly again. There's a certain, and then if that's the Golgi tendon organ. In the belly of the muscle itself, you have what's called a muscle spindle cell. And the muscle spindle cell is another highly specialized nerve that if there's too much tension on a muscle, it'll fire off a signal to the brain. And when muscles get too much tension on it, they're set to fail. So, but trigenics is a topic for knee pain and other pain and for another day, but it's a phenomenal treatment. But we use that in addition to the knee on track for doing the knee pain decompression. Okay. Um, the good thing about knee pain decompression is a non-surgical treatment for people suffering from knee pain. You know, and it was really a pretty cool device because what it does is it just gently tractions your knee out and it lets you put it right into a good position, and you're able to stimulate production of synovial fluid. Now, synovial fluid is basically like oil is for your car's engine. Okay, so that's the sweet part about the decompressing on the knee. The device is called a neon track. What we're doing is we're decompressing the knee, allowing that synovial fluid to be produced in the joint capsule, which it does naturally. But like anything else, as you get older, you're going to produce a hell of a lot less. So if you're having tendonitis, arthritis, bursitis, tendonosis, sprains, strains, even ACL injuries. Now, if it's torn, you're not coming here. I wouldn't take you as a patient. So what happens is it's not a cure all for all things, but it's a fantastic way to get therapy to the knee. And then again, then you have to do some physical therapy. But what's your thing here? Do you want to avoid surgery? Do you want to avoid knee replacement? So biggest benefit here is that you going to help have a reduction in inflammation. You reduce the inflammation, you're going to decrease the pain levels. So those are two things. People, you feel pain, you have pain, you have inflammation. Inflammation is just as damaging as pain because sometimes you don't feel inflammation, especially think about heart attacks. A lot of times people have all this tissue, inflamed tissue, yet they have no symptoms. Well, let me tell you something. Inflammation is something you have to be concerned with. And as it relates to a knee, if you have pain, you're going to have inflammation. It's just the way the body starts producing certain cells to help minimize the pain. So I won't go into that today. But the idea here is decompression therapy is a viable way to avoid knee surgery, knee replacement. And if you really, one of the things that's really interesting is how, if you think about it, we've actually treated people who've had knee replacements. Okay. But here we have a non-invasive treatment, to work on all those different knee injuries and stuff like that. And it gets you better. Usually people start seeing improvement within 3 or 4 treatments. So basically, if you got stiffness in the knee joint, if you have pain when you go up and down the stairs or go from sitting to standing, if you can't move the knee, tendonitis, osteoarthritis, DJD, tears in the meniscus, sharp pains, these are things that erode the quality of your life. And what we really try to do here is add quality to your life by having these different therapies. So that is really what knee decompression does. Very gentle, very safe, but also very effective. There's very few, it's kind of hard to have any side effects when it's non-invasive. I guess you would have to consider, if the pain gets worse. If the pain gets worse, then you probably do need surgery, but you're not going to know unless you give it a try. So that's the thing here. That's probably the biggest side effect. Um, you know, Rest, ice, Advil, Aleve, injections. This so low level of therapy. And if you're an active person, you want to stay active, you want to ski and play tennis, then this is probably the course of care you should be looking at. It definitely. And afterwards, and you'll start to see more mobility. I mean, that's the one thing is when you start to reintegrate the muscles using the trigenics part of the therapy, you will see a significant improvement within the first few treatments, which is really good. But after you're done, you got to get back to being active. If you're coming in here being inactive and we get you out of pain, you got to stay active. It's just don't bother coming. Is really what I'm going to tell you. If you can't, we get you the improved mobility, much more comfortable. Well, then you really got to keep at it because it's not going to stay that way. You know, People often ask some of the FAQs, how long does knee pain decompression session last? It's about 45 to 50 minutes. It's not a quick fix, and it's not your average therapies that you're going to see elsewhere. I can promise you that. We use several different therapies because the other therapy, we're going to send you to a PT afterwards anyhow to strengthen the area. So people want to strengthen it first. You have to make sure the neural connections are on, which is what the trigenics actually does. It restores the neural connection to the knee and very, very effective. You'll see a change in strength also almost immediately. But that's not going to work the whole motor unit, and that's something we have to do a little bit differently. So initially, basically, what can you expect after procedure? You can expect more mobility. I mean, each time you come in, you're on the decompression machine for about 15 minutes. It has a big impact. It really does have a great big impact. Um, but the key thing is, what I want to really harp on is making lifestyle changes after medical procedure, like the neon track for decompression therapy. The difference is between success and failure is making those changes. If you're a couch potato, then just go get the knee replaced. You're not gonna. But if you get the knee back and you're still in good enough shape to do something about it, make that a permanent part of your lifestyle. I mean, I don't want to see you back here after we go and fix your knee, but make it part of your lifestyle, and I think you'd see a better quality of life because the more active you are, the better you sleep. I'm saying physically active. There's way too many benefits. You get more oxygen going to your brain. So there's a lot of stuff that we can do here, but getting you out of pain with least amount of trouble getting you out of pain with the knee on track is clearly it's a home run. It works. I've had done to me. I don't bring stuff into the office here unless I've done it on myself. So the knee on track is the most effective way to do knee decompression therapy. And I think you might enjoy the feeling of having your knee back. I'm Dr. Brian McKay, not just a chiropractor, Darien, Stamford, Darien, Norwood, New Canaan. Talk to you soon. Got a question? 203 656 3636. Bye.